Hi everyone, welcome to Dr. Deepa's Learning Launch. This is Dr. Deepa, and today I'm sharing with you a very highly important high yield table that is there in my book, which is One Line Wisdom and Practical Pearls in Hematology. So if you look at this table, this is your interpretation quick flashcard for you to understand and interpret the 5 important tests in coagulation. So, as you know, for any patient who has some bleeding disorder or some petechias or any other signs of bleeding disorder or is having a problem with the coagulation pathway, then you would want to advise the patient these 5 basic tests, which is platelet count, PT, APTT, TT, fibrinogen, and what is the likely interpretation you're going to think about it on the basis of the results of these 5 basic tests, and then you would branch to further evaluations if as and when required. So if you look closely at this top rows, this row is of the conditions that is actually having a normal PT, normal APTT, normal TT, normal fibrinogen, and a normal platelet count. So, as a normal individual can have this profile, the others who can have the same profile includes factor 13 deficiency, mild von Willebrand disease, a qualitative platelet disorder, connective tissue disorders like EDS, and a mild coagulation factor deficiency. So in case the patient is having some sort of a bleeding diathesis and all the tests turn out to be normal, then you may have to investigate in line of these likely interpretations here on this table. Then if you look at the next column, the next row here, then if only isolated PT increase is seen and everything else is normal, then you should think of factor 7 deficiency. That is what is the likely diagnosis in the patient only when isolated PT raise is present. Now look at these set of rows. If you're looking at these set of rows, you notice that the PT is normal, platelet count is normal. It is only an isolated increase in APTT that you're seeing in these patients, and everything else is normal. So the conditions that are in line with only an isolated APTT is intrinsic pathway defects, which includes factor 8, 9, 11, and 12 deficiency, von Willebrand disease if it is factor 8 reduced, and lupus anticoagulant occasionally, and a contact factor deficiency like high molecular weight kallikrein or prekallikrein deficiency. So in these conditions, there is an isolated APTT raise. Now look at the next set of rows. This row is for all the conditions in which the PT and APTT are both raised. So in this condition, both PT and APTT are raised. So the disorders in which there is raise of PT and APTT alone and the platelet count TT and fibrinogen remain normal. These include the common pathway defects, which is factor 2, 5, 10 deficiency, multiple factor deficiency when there's a combination of, let's say, factor 5 and 8 deficiency. There can be combined factor deficiencies, or in warfarin or vitamin K antagonist therapy, or vitamin K deficiency or defects in the vitamin K metabolism. All of these result in both PT and APTT being increased. Next, look at this set of rows. In this, you have conditions in which the platelet count is reduced and you have an increase in the PT, increase in the APTT, increase in the TT, and a reduction in the fibrinogen. So the conditions that are in line with this combination is DIC, massive transfusion reactions, severe liver disease. In all these conditions, you will have a decrease in platelet count and fibrinogen and an increase in PT, APTT, and TT. If you look at the last row, here you are seeing that only the platelet count is reduced while everything else is normal. So this is a primary platelet disorder like ITP. In that condition, you will be able to see this type of a coagulation picture. So this is a high yield picture for very, very important for your understanding of coagulation pathway. And this is a very, very quick revision for your exams. So in case you like this, please go ahead and purchase the One Line Wisdom and Practical Pearls in Hematology. And for the benefit of students, I have kept it free of cost on Kindle Unlimited subscription. This is Dr. Deepa signing off today. Bye-bye.